Well, as you all know, we had quite a surge here in September, into September, October. I can tell you, like the first Thursday of September, we had 17 cases, and we could slowly start seeing it go up. The third week of September, we had 154 active cases. So it just went crazy. A lot of activities over the Labor Day weekend, you know, like traveling, school coming in session, college coming in session, those kinds of things, I'm sure added to that. On top of it, the public health nurse quit mid-September. So that left just a couple of us trying to work on this, and then the other person had a vacation scheduled when I hired her. She already had plane tickets, so I had to let her go for 2 weeks. And that was just during all this, so it was basically Lily and I. So needless to say, we were not able to get to all the cases. A lot of them went, we didn't get them called or anything like that. And by the time we got to them, they were already out of isolation and everything else. I did ask all the providers to make sure when they call their patients with the test result that they do explain what isolation, I think they were doing it anyway, most of them, explain what isolation is and how long it is, what their isolation period would be. So they all knew what to do for the most part. We did get some home testing kits that we handed out during Labor Day at the fair. And on one hand, that's great. They can test themselves. But on the other hand, if they don't call us, we can't follow up on those. So I think there was possibly a lot of those out there that were positive that we never knew about. Those test kits were free, so we did have a lot of people requesting them, but they went like that. They went really quick. There might be a chance we can order some more, because they are good to have. Yesterday, once we got our disease intervention specialist back on Monday, she was able to help us out a lot, and her numbers are, we have 60 active as of yesterday. So it is coming down, thank goodness. As far as the vaccination update, so we do provide COVID vaccine at our office right now every Friday. Currently, we do have all 3 formulations. We have the Moderna, Pfizer, and the J&J vaccine. It's already complex as it is with the storage requirements and all the other different things, but now they're throwing on all these boosters and now different doses for the kids, and it's getting way more complex. So I'm not sure how we're going to do that. We may have to go to the bigger clinics again and have several different vaccinators, like one just for this group and one just for this group, and just to avoid any errors. So anyway, I'm looking forward to it, but process-wise, I'm not. I'm not sure what our county is up to right now. Has anybody looked at the map? I think we're like 71. No, as far as percentage vaccinated?
55.
Are we 55%? Yeah.
So.
Yeah. So that's fully vaccinated. So we're getting there. It's slow, but we are getting there. Does anybody have any questions about any of that?
Okay. Public health, did that cover the COVID-19 vaccination update?
Yeah.
Okay. Okay, then we'll move on to the discussion, the way it reads, and/or action items. Full business approval of the July 8th minutes for those board members here.
Move to approve.
Got a first, got a second?
Second.
Got a second. All in favor say aye.
Aye.
Aye. Approved. Okay, under new business, we'll start with the new Board of Health laws. Is there anybody want to open that?
Well, I thought you would, since you and I talked to Jed.
Okay, do you have a minute? Do you have the notes on that?
No.
I don't. Jed's sparsely caught. I was going to have him come today, but he wasn't able to do that. So, but anybody have any comments on those laws?
What laws are we talking about?
Well,
first?
these are the ones the legislature,
Okay.
the new bills.
I mean, I can give a summary. So
Go
we
ahead.
went to Jed to discuss, because every county is supposed to go to their county attorneys and talk about how those laws are interpreted. And I can tell you the quarantine and isolation one is really getting misinterpreted a lot. The only thing that changed in that law was that people have to be confirmed positive, not suspect, before you can isolate and quarantine. And we do that anyway. So that wasn't a change.
It's not just saying they must have tested positive before you can quarantine and close contact?
Not quarantine, isolate.
Isolate?
Yes.
And close contact?
And close contact is quarantine. They must be identified as close contacts.
They must be identified as close
Yes.
contact.
Yeah.
Okay.
So we don't do suspect stuff.
First off, on the question, let me just start with him. How come Jed, is he still the county attorney?
He can. He's
So he can't practice in court? He's not
Oh,
going to
yeah.
handle any of the court cases?
He does handle court cases. He assists Thorngeist. We got a attorney out of Missoula, Thorngeist. He offered to step in and when Jed's off at MRIs and tests like that, then Jed electronic.
Jed is gone all the time?
No.
So why is he doing all of the court cases?
He does some court cases. And
Fitch doesn't
Thorn.
do hardly any.
But
so-
Thorn is, well, a lot of times they electronically go back and forth with each other too on decisions and stuff. I don't know, the state of Montana approved what we're doing.
No.
And so we're good to go there. But he was in yesterday for a while, but he's very,
And so why
Day
did
by
you
day.
guys go to visit him to come up with what, without giving us as a board, if you're gonna have him try to tell us what we have to do, which I don't agree. He's the one that we would then as a board get together and decide and ask a question of him. And then he would give a legal opinion. I don't believe the law has anything to say on isolation or quarantine. Well, what I understand the law says is the Board of Health, the local Board of Health comes up with the rules. And then it has to be decided and approved on by the governing body, which we don't have any right now. So the way I interpret it, there are no rules right now for isolation or quarantine because the local Board of Health has not set one.
I'm just telling you what he said.
Well, and I'm just,
Well, that too is left to interpretation.
that's right. She's left to interpretation. There's
Correct.
wide spots in the new laws, I guess you'd say. And the way Sue and I were there, he'd emphasize House bill or Senate bill such and such, and then he'd go to the other bill that somewhat contradicts that bill or doesn't mesh with it, as he put it. So I think there's windows of confusion in them myself. But
Well, then
believe me,
have
I'm
him-
no attorney.
and then have him come in and tell us all what the
And he's-
basis is. If he's practicing right now, he should be telling us,
Yeah.
not telling to you.
Well, he just came in and said that, and we offered to have him here, but his answers to his appointments, to be honest with you. You know, he's scheduled for MRI in Bozeman and different things are happening to him, so. And then Thorne is in Missoula, and he takes care of a whole lot of the cases going on, and he'll refer back and forth, but he too has a schedule. And then we've been trying our darndest to hire a deputy county attorney. We can't find one, just can't find one. There's 6 or 7 counties in the state looking for deputy county attorneys and what you can't find. So that's where we're at. So go ahead, George.
Yeah, Tom, I brought this up before, and it's not to impugn those that have been trying to do their job, because I know that there isn't the knowledge or the advice out there so that they can do their job, specifically the health department. But we have 2 approved people in this county that can do this, and those are both mayors. Now, one of the problems that we have, and I believe this is pretty much statewide, is to impose the police powers of the state or the jurisdiction. Those people have to have taken the oath of office. Now, in research for my appeal, there aren't anyone in the health department that have taken that. And so my recommendation has been and continues to be that the health department works with the mayor specifically in the city jurisdiction. And I don't know what to do in the county jurisdiction, except you're going to have to get the rules kicked together. That's all I have.
Any other comments on the new, in the school district world, have you solved this discrepancy, if you will, in the new bills and House bills, and tried to administer that the best you can? I mean, I think you're doing a heck of a good job. It's just a matter of the way they're worded and how they apply location to the school districts in Montana.
If you're asking for a response, it's a mess. But I don't know if now's the time for me to respond. I did have a comment, Tom, but
Go ahead.
well, I see them on the agenda later, so I don't know if now's the appropriate time, but I just wanted to again thank especially Sue and Dr. Evans for all their support and help and stuff like that. I was a bit offended by some of the stuff in the paper yesterday, and I wanted to come and defend a little bit what we are doing in the district, and to let everyone know that we're not trying to put anybody at risk, and we do not believe there's a liability issue. I know there's an article that came out in the paper yesterday, and so I want to be clear that my board is doing everything they can, and we are doing everything we can to keep kids healthy and safe. I know Sue and Dr. Evans don't maybe agree with it 100%, but there are a lot of districts that are doing actually less than what we're doing. We are actually putting masks on kids when they are considered a close contact with parental permission. And so one of the big things was parents wanted a choice, and so we've given parents a choice. The child can stay in school and wear a mask if they've been considered close contact, or they can pull the child out of school and we will remote teach those students for the time that they're out of school for up to 10 days of last known contact. The article in the paper with the high school yesterday made it sound like, you know, we were putting our people at risk, and I just don't believe we're doing that. In fact, we are getting to them a lot quicker than county health is, you know, no offense to Sue, but is overwhelmed. And so we actually weren't getting some of the quarantine notices until 8 to 10 days later in some cases, not in all cases. And I think Sue is doing a phenomenal job. I want to make that clear. And yet we were getting some of these notices, especially when we were inundated here a couple weeks ago. But we are now, able to contact those students and those families immediately, and they either put a mask on or they go home. And to be quite honest, and I have a packet for the Board of Health, if you want, Tom, to hand out to explain some of that. One is to explain our policy, and then there's some numbers, some statistics in there. And I'm not saying this is why, but since we put the mask on, we went from 18 to Our first week of school, we had 2 positive cases. Second week, we had 17. The third week, we had 14. And fourth week, we had 18. And that's when we said we need to do something, because we also believe that the best thing for kids is to be in school. And I don't think that's being disputed anymore. Unfortunately, for a while, it was being disputed, not by our people, but nationally. And it's a crime that some kids are still not in school around our nation. I guess that's just my opinion. But what's best for kids is to be in school, and so we're doing the best we can, working with Sue and County Health, and working with our parents, and working with our students and our staff, trying to keep kids in school. And since we've implemented this new process, we went from 18 down to 8, down to 0 positive cases. Now, Sue knows these numbers better, and so that might be a little bit at dispute, because we don't always get the numbers immediately. But as they go off our caseload, sometimes they go on to Sue's. But the point is, as you look at these numbers, is it definitely has gone down. I'm happy to try to walk you through these better if you want, Tom, but I don't want to waste you guys' time. They're pretty clear in here. You'll see park views. You'll see the policy that went home to the parents, and where you really want to look is down under close contacts, and that's the new policy that we're doing with, I think, Sue and Dr. Evans' blessing to a degree. They don't, they have some concerns about it. And then the next page you see are some percentages. The next page you see is just another way of looking at the numbers. The next page you'll see where it's just a little bit, and this happens every single day. I get from Mr. Fitzgerald here what's happening in the elementary school, and you'll notice we combine COVID and sick. Some people don't like that, but we assume that some of those kids that are sick are not being tested, so we put them in the category of potentially being a COVID positive. And so we have a percentage that we look at, and if enough of our student body is out either with known COVID or with being sick, then we will take appropriate action. But that's what this sheet is. The next sheet is the middle school numbers, and the last sheet again is a middle school, and it's a graph, so it shows you really clearly what's happening on a daily basis. Mr. Rogers in the middle school, Mr. Fitzgerald in the elementary, and myself are looking at the numbers and what they do on a daily basis. So anyways, I just want to reiterate, really appreciate Sue and her efforts, Dr. Evans and her efforts, all of you guys with the Board of Health. But we are trying to keep kids in school. We're doing everything we can to do that. We think that's a positive thing, and we think it's working for the most part. We definitely did. Our board changed the policy to, we were uncomfortable sending healthy kids home, and so we've changed that a little bit. Again, I don't know that Sue and Dr. Evans are 100% supportive of it, but I think that they've been great to work with in terms of trying to support it and trying to keep our kids in school and those types of things. And honestly, whether it's that or whether it's something else, our numbers have dramatically come down, and we're going to keep, I'm sure we're going to see a spike again, and we'll do, we'll do whatever we can to keep our kids and staff healthy and our community, and work with Sue and Dr. Evans in making that work. Greg, do you want to add anything?
I think one of the big things that we also do, and it can't be discounted, kids sick, they go home. I mean, it's not as if we put a mask on a kid and say, you're fine when you come to school. They're sick, they go home. And our policy is that they have a cold, they have a fever, and I know that it might upset some parents sometimes. We're trying to keep our kids and our staff healthy. So this policy really does, I would say it's the best of both worlds in terms of from a school standpoint. Keep our kids in school, we also give the parents the option. The parents have the option to do that. We find out a COVID positive case, and Randy articulated this earlier. We get a COVID positive, we actually call every student's family in that classroom and say, hey, there's a COVID positive case in your classroom, they're going to be masked for the next 10 days, and we give them the option at that point in time. Some parents have chosen to take their students out of school because they either didn't want to wear a mask or they wanted to keep them home to try to keep them safe. So it's something that does meet the needs of our kids. We have right around 88% of our students that are in school all the time. About 4 to 5% are out sick. That's normal. That's a normal fall for us. And so we have to keep our kids in school. The most important thing is that they attend school. Last year and the year before, when kids weren't, we've seen a huge decline in some of the things that our students haven't learned. And so we're trying to make sure our kids go on the right path. So I think this plan works, and it does, I think, take some pressure off county health. I really do, you know, because we're doing it on our end. And county health doesn't get every test. They don't. We get a phone call from a parent that says they've taken a home test. We use the same procedure. So I think it's just trying to keep everybody safe in our school. And I think the liability thing, there's no proof that they got it from someplace in school. And I think that's something that came up. And when I read the article, that was one of the things that came to me, was that, you know, it's a liability situation. It's a liability situation. You go into the store. A kid could get COVID in the store. They could get it walking down the street. They could go in a hallway. To pinpoint it on the school because they're, you know, a kid hasn't been quarantined because they're a close contact. It's to me, it seems it's a stretch. And I think that's what the struggle for me is that, you know, liability and legal liability and potential litigation. There's potential litigation on everything. And I want that to be clear, that we're doing everything within our power to keep our kids and our staff safe. And I think the plan's working. So.
And last point, if I can, Tom, talked to Mr. Haverfield last night. He's talked to several other districts. We did do some research. We did look at what some other districts are doing. There are other districts that are doing this. Madison County, the Madisonian had an article in last week's paper, I believe, where all the county superintendents there are meeting with their, I don't know if it's county commissioners or board of health or what it is, to change the policy exactly what we're doing. And there are many schools that are doing this policy, as I mentioned earlier, but I want to mention again, that are not doing it as well as we are. They're not putting the mask on kids, and that's what's being found across the state. And so we actually feel like we're doing it better. And my last point is, again, we don't want it to sound adversarial in any way, shape, or form. We appreciate everything that Sue and Dr. Evans and the rest of you are doing. I mostly mention Sue and Dr. Evans because that's who we mostly work with. We don't want it to be adversarial. We want it to work for everybody. And that's the problem, is everybody's adversarial now. Everybody's either way over here or way over here. And we feel like we've succeeded because we've upset everybody. We're right in the middle. So everybody that wants masks all the time, they're not getting that. Everybody that doesn't want masks, they're not getting that. So we feel like we've succeeded. But we definitely don't want it to be adversarial. We're here to support Sue and Megan especially, and the Board of Health, and mostly our kids and our staff and our community, and trying to, well, the parents, you know, and trying to keep everybody healthy. We're trying to do the best we can. But health is also the mental and social well-being of our students. And the research is clear that our kids should be in school, if at all possible. We're willing to shut down school if that's what, if Sue comes to me and says we need to shut down school, I'll be her biggest proponent in following through with that. So we want to do what's right, but we want to have our kids in school and do the best we can that way. And again, we could shut the entire country down, but we better shut everything down then.
And that wouldn't help any.
No.
As soon as you open it back up, everybody's affected again. So let me ask you a question, man.
Go ahead.
On the how do you determine day zero for like quarantine and isolation? I know you made a statement in here kind of that if they're asymptomatic, I don't even know how you guys determine that they're sick. Okay, but also let's say the first time is somebody starts coughing or they look like they're sick, that would be day zero, right? Not did the public health come back 10 days later and say they're infected. That would be day zero, right? So if the test comes back long time later, you don't start the time over again for the kid. That's when you determine they're sick or infected, that's the day zero, correct?
That's true, Mayor, except that County Health gives us guidance here, and we go back 48 hours from that date. So go ahead, Greg.
So it's the last known contact when they were in school. So if they were sick, we had a student come to school on a Wednesday morning. They weren't in school Monday or Tuesday, came to school on a Wednesday morning, went and got tested Wednesday afternoon and were sick. So we went from that Wednesday when they were in school. So it's only at that point in time. And we've had other students that have been out And
We have a student that might be quarantined from family, and so they're not, and maybe that's on a Saturday, and so on Tuesday, we find out now they're positive. They haven't been in school for 4 days, so there are no close contacts in school. There could be close contacts with siblings in the home.
Okay.
Yeah.
So I just wanted to talk about, the public health point of view. And again, we've told Randy, we've told Gary that we absolutely agree in school learning is extremely important, and we do understand the disruption with all these quarantines. We get it. Especially Dr. Evans, she has kids in school, so she gets it. However, as public health officials, we can't promote this because it's not proven. It's just something that has come up that maybe appears to be working. And so we've told them, but we'll try to work with them the best we can since it's already been passed by their school boards. So it was our understanding it was disruption to the learning environment. I think what our concern is that it's allowing the kids to play sports and go visit other schools and that kind of thing is potentially a concern, because my response to you, they're known contacts. People that are walking around the store, they're not known contacts. That's what our concern is. That is anything going to happen? Probably not, but just in case, you know how people can come back at you and say, oh, those were known contacts and they were playing sports and now my kid's positive. So that's where that came from. It's the known contact part of it. I don't know, Dr. Evans, if you wanted to.
Yeah, I think that we support the plan as much as we can help. I think it's just our first choice would be to follow the CDC guidelines, which just recommends everybody mask. And then kids aren't considered a close contact if they're both wearing a mask, and then everybody would stay in school by following those guidelines. But I understand that that's not what's passed the school board. And I think as far as where the legal liability stuff comes from is some of the guidance that we've just received from DPHHS, which is from the governor's office, on how they suggest we interpret things like House Bill 702. And they have just said, please express to people if they don't follow quarantine, if they're supposed to quarantine and they know that they can be legally liable. That is just what they said in one of our meetings. So I'm certainly not a lawyer. I think we probably need to get Jed's input on that further, but that's all I have to say about that.
I read the same thing and I totally disagree.
It was in a meeting with DPHHS.
Right, well, they also put out some, it's not really even an order, just their position, and they had no lawyer look at it. They have no power to make a legal decision on.
It's my understanding that it was DPHHS's legal counsel and from the governor's office that gave that recommendation. That's all I'm saying.
Well, I don't think it came from the governor's office.
They
but
said it came from the governor's office.
DPHHS.
I can find it for you. It was in a
I
meeting.
read it.
It says something about the governor. Go ahead.
So, from the perspective of a parent, listening to Randy Shipman seems to be a lot more effective than what we're really doing right now. Similar to a case like head lice. When one kid in the classroom got head lice, all parents were notified and we were on alert. We knew not to send our kids to school, which meets the request of both agencies. If you know you're in close contact and you believe, then you can take the appropriate action item. So as an example, my student was 2 days into school, and I had removed him from school to go to the county fair. And I got a notice on Wednesday, a robodial Wednesday night, that the high school had a positive case. Okay, fine. So I say to the county fair leader, do we remove the high schoolers that are in the concessions shack right now? Oh, no, don't worry about it, because at the high school, we don't go to bed until we get our standard, there is a positive case. So you have people dismissing the others, right? We have this routine to dismiss the alert or the alarm. Okay, fine. So we leave the high schoolers in the concessions shack right? That is on a Wednesday afternoon about 3 o'clock. Don't worry, okay? So on Friday, midday, I get a phone call from County Health on my cell phone. So now we have all the kids down at the fair, riding the rides, making out, doing what the high schoolers do, right? I mean, let's all use our mind. We're in close contact, though I think at this point you can see people definitely distance a little bit now when they're in groups. I mean, I see that, but the kids are still playing. And I get a notice that my son is a list on close contact. So this is where my concern is. There's other laws besides Montana state school laws. It is not unusual for a school board to make a policy that actually only hindsight is they violated a student or a student right. It happens. We don't make all these things because there's an attorney sitting in front of us. So the phone call goes on, and I have to say it was somewhat threatening because it was you do this or else. Did you do this or else? You do this. You give me a close contact list. Absolutely not. You go get him tested between day 5 and 7, I think is what it said. Or he can't come back to school. Or if he's this, he can't come back. I said, don't threaten him with a good time. We didn't go back to school for 15 days. It's sad, it's sad. That's not how this should play out. Also at that time, I want you to know that the health official, and I still have her name, gave me and disclosed the first and last name of the little girl who tested positive. Now, I don't know if they had the consent of the parent. Possibly they did, so let's give everyone the benefit of the doubt. But I was also standing next to one of the high school teachers, and then 2 other, I think, fairly well-known people, and said, hey, this just happened. How often is this happening? We should not be disclosing what's going on. I did ask my son, do you even know who this girl is? He said, no, Mom, I don't know who that girl is. I said, can you dispute that you were in the classroom with her? I don't know. I don't know who she is. I don't have any right or way to dispute whether my student was really in close contact. I really can't. No symptoms. There still hasn't been sick to this day, and is back in school. But it's exactly what Randy Shipman said. You know, one, if Randy Shipman calls me on day 1 and says, hey, by the way, the whole classroom, guys, then I can take the appropriate action in a timely manner, not send my kid to the fair. I have a letter here from County Health that states that they're behind and in many cases can't get the information to us, right? That's exactly what happened in this case. We have a policy at the schools that says we don't send our kids when they're sick, and the parents have to adhere to that. The quarantine, the constant quarantine though, is making it very difficult for parents to go to work. One day you're going to work, the next day you're trying to find a daycare who will take in a close contact, right? So this is affecting people financially, but we've already stated the current process in place in Baldwin County Health has nothing to do with how hard they're trying. It's the limitation of staff, the limitation of getting the information to us so we can actually do something good. I mean, seriously, it's coming down to the parents at this point. I've heard of parents not taking phone calls on purpose so that they can't be notified. I've heard of parents, essentially at the high school, if I understand the process at the high school is, I received the notice of close contact quarantine, but that notice doesn't go back to the school because my son was marked as an unexcused absence the whole time. And they made me produce the document from county. I said, why would I do it? You guys are the ones that quarantined him. You gave him the information. What the heck have I got to do with it? I got the notice, I followed through. But it was do this or else, do this or else. There was a perfectly healthy child there. In this case, there was a perfectly healthy child. He did go back to school. But Randy Shipman's approach reconnects the parent to the school and gets all of us doing what we need to do in a more timely manner, and also gives us options. So it is not surprising that he has a decline in his numbers. You add to the numbers that Sue started with. Are there any other numbers? Yeah, there's all the ones that we lied about. There's all the cases she never knew about. because people are refusing to disclose information because we're not included in the process. There's no, give the parent the option to get participating and do what's right. Does that make sense? It's not working the way that we're having it because we're adversaries, just like Randy said. We're not being cooperative at this point. We're tired of all the kids being sent home. What about the taxpayers that paid for our children to get educated? You're taking the money, but we're not getting educated. There's a lot going on. We need to work differently.
Okay, thank you. Thank you. Is there any other comments? Randy or Greg, have any comments to that? Or go ahead, George.
Mine concerns, first I want to give accolades to both of our school districts, both Randy and Gary. The boards have been excellent to work with. They listen, they're attentive, respectful. My experience at the high school board, I haven't attended yours, but I've watched you and you're doing a good job. In comparison with that is my granddaughter's in the Missoula County School District, and that's a mess. And I've been in touch with the governor's office on and off for the past 6-7 weeks. Talked to the governor's chief of staff. And the governor has written me back. And my concerns, and I need to even add to that, and I've talked to the paralegal for the lawsuit that Quentin Rhodes represented the parents that failed in district court. It was a civil suit against the Missoula County school districts. And I advised them and the governor that they're ignoring House Bill 501 and the law that was just put in place that extended the criteria for trespass, which is how most of these entities deal with individuals that they want to mask or vaccination status, etc., that says you can't do that if the public money's been in there. And it's a criminal violation if you do. And because the governor and the superintendent of schools put out their recommendation directive as how to comply, the governor's office is reluctant to enact the criminal statute. And I've even offered to make the arrest. The problem is we don't have a prosecutor in Missoula because they're already conflicted, which means the governor would have to get the attorney general involved. They're not going down that road, but the problem is when you ignore that criminal statute, you're putting yourself at risk. And your process is a good process. You can defend that because you're utilizing criteria that says we're protecting the safety of this public. But to just enact as Missoula did through closed meetings and not taking any public comment, those people are subject to arrest. And it becomes a felony when you go far enough down that road. So I just wanted to put that on the table. That is one of the strongest laws that was passed in this last legislature. And it hasn't been utilized, but it certainly can be. And if Missoula people knew that that was available, I'm sure they would avail themselves to that process. Now, when you look at the legal aspect of it, a lawyer can't make money off of that legal challenge if it's criminal. Therefore, they go with the civil. And that was part of our discussion with Quentin Rhodes and his people. So they're reluctant to go in double barrel because they're not gonna get the money off the civil suit. So, that's it.
I think you're doing a very good job, don't get me wrong, okay? You are doing, I think you're doing the best you can with what's going on. My question is more of a question, I might have a response after, but where are we getting the rules that we're gonna follow?
You're gonna have to speak up, because she
Oh,
can't
sorry.
hear you.
Where are we getting the rules that we gotta follow for isolation and quarantine?
Montana Code annotated.
Huh?
It's in Montana Code annotated.
Yeah, I see that you have that power if the Board of Health gives you the power. But from annotated, where are we getting the rules that set up for 10 days and all that other stuff? Where's that coming
That
from?
comes from CDC.
The
Because it's
CDC?
specific for COVID, yes.
Now, the CDC is just a recommendation. There is no rules that you have to follow. So where else are we getting our rules to follow? Because the CDC is just a recommendation. That's all the power they have. They have no power to make any rules, any laws. They cannot enforce any rules, any laws. So if we don't get it directly from the governor or from the legislature, and what we have from them says that the governing body through the Department of Health, or the Board of Health, or the local Board of Health, we're the ones that set up quarantine and isolation rules. And right now, truthfully, I told you before, we don't have any rules right now. Because we've taken so long since they passed these laws, we haven't even set up the governing body to control
Right.
what comes up. That's why, part of the reason I wrote what I wrote, to try to get this pushed through. It's good, I'm surprised that we didn't have this in the packet, to try to set up the new one. I'm not against it, I'm not for this, I gotta go read it first, because we just got it this morning, but I am for trying to get rules set up that we have the power, but if anybody gets in trouble, if you wanna talk legal, just keep doing what you're doing. You have no power to do it. You have no authority to do it. You have the authority through MCA, which I put in that report that I wrote. The MCA gives you the power through the local Board of Health. They have to set up what quarantine and what isolation is. Now, they can take recommendations from the CDC if they so desire, if they think that's right. Myself personally, this is my personal, I think that the CDC should be called Center for Death Control. Okay? They're just out trying to kill people on a lot of their stuff by saying that you can't.
I do too. I think that's ridiculous.
So how is, when you sit here and say that we have vaccinated a lot of people, yet now we have more deaths in 2021 than we've had in 2020? How can we say we're actually helping? How can you say we're even controlling anything with COVID?
Those are all questions.
I
Well,
figured,
and those are questions, and we went off track.
We are very
have
off
to
track.
do isolation and quarantine. And right now, by legal wise, if somebody decides to take you, you're not protected.
well, I guess the whole state of Montana isn't protected then.
Well, no, a lot of them have Board of Health that have set it up, local Board of Health that have set up their rules.
So my understanding is we still have Montana Code Annotated 50-3, which gives the public health officer authority. They did not rescind that. That is still
The
there.
authority is given through the local Board of Health.
And the health officer.
And is that the new law? Is that what we're talking
No,
about?
this is old. This has been.
Okay, I'm just trying to make sure we're staying on the agenda. Is that what we're talking about in the line?
He drifted.
Okay, all right, I'm trying to keep up.
That's the new laws.
So this is old. It's been there forever.
So we have no Board of Health.
This is our.
No, this is.
We do have a board.
This is the Board of Health.
We do have a Board of Health. which
Okay,
is-
thank you.
I just don't know if it's worth us arguing about it if we don't have our legal counsel here.
I agree. I agree with you. I agree with that, because
Okay, so
he was, approached, but can't be here.
Real quick.
Go ahead, Randy.
I just want to say thanks to Michelle for the nice comments and support. But going back to kind of where we started with Sue and Megan, I understand what Sue's saying completely, that she can't support it, research-based and all that. And I respect that and I support that. I also, though, am appreciative of them being willing to try to work with us. And again, I don't want to beat a dead horse here, but the fact that we are masking those kids right away, which is not to everybody's desires, but we really do, we're really trying to keep kids in school and keep them safe and give parents a choice. And so I appreciate Sue and Megan being supportive as much as they can towards that. As far as the quarantine and isolation, stuff like that, we do. We take our cue from county health on that, and I do think, I understand completely what the mayor's saying, but I think they have that authority to, from the trying to, county health, trying to, the responsibility that they have for the health of our community. I do think they have some power, and that isolation and that quarantine, those days, I think, is where that comes from. And yes, it's probably from a CDC recommendation. I, like the mayor, don't believe in everything from the CDC, but I think that they're doing the best they can with the information they have. And I do think that we're happy to support the quarantine and isolations, the way that we get them from county health, and the way that we're offering that choice to parents.
Let me just respond on one thing. 50-2-118, powers and duties of the local health officer. That would be you, correct? Okay, under section 1, part D, as in dog. This has, what's the duties of them? Establish and maintain quarantine and isolation measures as adopted by the local board of health. That is your job, not from whatever the CDC might or whatever somebody else, says. You take your rulings from the local board of health. Now, that's in the new laws that just got changed, so.
I just have a question,
Sure.
I guess, for you and for Dr. Clacken. What I'm hearing from you is you want this entity, the our county board of health, to establish, to say that we agree with the current isolation and quarantine measures. Yeah, I know they've been put out by the CDC, but you're saying if this entity says these are the rules, then you think that's appropriate?
Well, if this local board of health comes up with those rules after a public hearing or a public meeting and discussion, and then the way the rules have changed, then it has to go to the governing body, which we really don't have. And they have to either agree or disagree with those rules. And then and only then can they enforce those rules. So the Board of Health will create or propose some rules that will then get submitted to the governing body, who then will agree or disagree. If they disagree, those rules are not in effect anymore. They weren't in effect anyway until they agree. That's what the law says now. I'm trying to protect you guys, truthfully. You might not believe it, I know, but.
Yeah. George, short.
Yeah, and this goes back to March of last year when Jed and I got in the argument, I'll call it. It was a friendly argument, but I questioned that we had the rules to do what we needed to do. And that was the basis of the appeal. And that's the reason that appeal was written and is on the table right now. We've yet to hear it. That's how far back I questioned this. And it has never changed. It's not to hinder you guys, it's to help. That's the whole point.
Any other comments? No, we kind of scattered ourselves.
Yeah, did we make it to the BCH District 10 school closed contact procedure discussion?
I was just going to ask if, on item 3 is BCHS district close contact protocols. Now, I guess I have to ask Greg and Randy, in your summary, did you cover that topic?
I believe so.
I thought,
We're doing exactly the same thing as District 10.
yeah, I think so.
So
yeah.
right.
So I have a comment on that.
Go ahead.
Seeing as Randy's here, and so is the principal, another principal. So I am challenging the release of the information from the schools to county health. The FERPA Act, which supersedes what's going on, does have a clause in it. The FERPA Act protects the student information from being released to outside parties that are not entitled to that information. It also gives the parent the right to dispute or deny the release of the information before it goes out. So I received a letter when I challenged the FERPA Act as to why my son's information had been sent to county health. And I got a letter back stating that, of course, there is an exception to the federal act. And of course, they want to outline it in a Montana School Board Association Act. So we'll see which one takes precedence, Mr. Shipman. And one of them is in the event that the, hold on here, protect the health or safety of the student or other persons, which other persons would be the community. That makes sense. And there's some goodwill and intent with this act that allows them to go ahead and disclose information in the event that something does need to be protected, right? And you would assume it would be an event of emergency. I mean, I think we can kind of take that off. However, in that, my understanding, Randy Shipman, as you were in here, my understanding is it allows, however, the schools must tell the parent and eligible student in the event that the student is an 18-year-old, a senior, about directory information and allow parents and eligible students a reasonable amount of time to request that the school not disclose that information. So why would somebody just not want that information disclosed? Well, because all information is being disclosed at this time. The information being released by the schools is not being run through a criteria of do we meet this requirement in order to protect others. So I have a letter from County Public Health, and I want you to read this or understand this. I believe it makes this situation null and void, Randy. Close contacts who are fully vaccinated and are not symptomatic do not need to quarantine. If you do not need to quarantine, then why was the information released? Did you qualify the student information? How would they know if they were vaccinated if we are purposefully, as adults and community members, withholding information? And you know it. You know we're doing it. Mr. Shipman, let's say as an example, because he's in here and knows how to play the devil's advocate with me, had he asked me if my student had been vaccinated, there would be, I would say, deny the request for the close contact. Do not send that information. My student has been vaccinated. He is non-symptomatic. I'm still following the recommendation. I'm still meeting what you want. But he got his information to me immediately. These guys are working overtime and then some, not seeing their families, the whole ball of wax. No one's arguing that you guys are not all working so hard. But we got a better solution here. And Mr. Shipman protected the information of the student, which he is the keeper of the keys. That is his main job and duty under that federal act, is to not release information that should not be released. And I think we're falling into this. We're just throwing spaghetti on the wall and see what kind of hits. If I don't get this letter from Sue in the mail, I'm none the wiser. I send my kid to school. Or I ignore it. I send my kid to school. I mean, Randy has taken an approach to work with the parents and get us doing the policing and following through because of his approach. It's a very non-threatening approach. Hey, Michelle, Chase is in close contact. What should we do? Oh, man, I think I better keep him home because you know what? He said he had a sore throat. All right. I can take quicker action like that than these guys getting something to me after I've been exposed half the fair. Does that make sense? But I think that we may have accidentally with the new vaccines and not knowing who's vaxxed and who's not, I think we might be hovering to needing to revisit that FERPA Act, because that federal act should supersede the school.
Now, not to throw a wrench in, but House Bill 702. Okay, let me just state this. Now, except as provided in subsection 2, it is unlawful discriminatory practice, which would mean that you're violating their constitutional rights when they say that. For a person or government entity to refuse, withhold from, or deny to a person any local or state goods, service, or educational opportunities. Okay, whether based on a person's vaccination status or whether the person has an immunity passport. You cannot ask or change and structure something different because of that. Not trying to throw a wrench, but, and I know this is being discussed quite a bit also up in the DPHHS.
I'm sure.
You know, but still, right now, if you want to talk about legal stuff, you're going to get a class action against you if you start asking vaccinations now.
And that's why.
That's what he said.
You can't, Randy, no.
Yeah.
That's what he
But see, we bypass the county, we bypass the state. The next step on the FERPA Act is to report the school directly to the U.S. Department of Education and request that they go under investigation. Still, all non-productive. How about we just work together? Seriously, how about we just work together? Let's stop sending the information out when maybe it should be sent out.
Okay. You had a comment, Randy.
I was just going to say, and that's why we treat everybody the same, because of House Bill 702.
Right.
Discriminate or, you know.
Which is why that quarantine letter is written as it is. Blah, 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 blah. We don't tell you one way or the other. This is, you know, it just explains that this is how it is. You choose whatever.
So the parent throws it in the garbage and sends it to school and withholds the information.
Right.
I'm only having an honest conversation as to what's really going
I
on
know.
in the
Oh, we
community.
know.
By God, we gotta start working together.
We know.
Yeah.
And we need to really look at this. And Randy has come up with a pretty brilliant idea regarding the schools, which
Okay.
puts it right back on us to take the action item, parent.
Yeah.
Okay. Any other comments about wore it out here? So,
One more thing.
one more short.
Yeah, it's short. I want to amend for Sue and Megan, my statement on the authority. Last year, when Governor Bullock's order was in place, you acted as agents under his authority. So last year, you were probably clear on a lot of what 50-2, et cetera, had. But this year, when Governor Gianforte removed that, you're no longer agents of the state authority, so you had to fall back onto your local authority, which we had none. That was the issue. The only one that had the authority was the mayor.
So, well, I'll ask him, you know, I asked Randy and Greg on item 3 there about the contact protocols, and he commented that you've addressed that. And then the potential new laws to sign in, but we can't really go there a lot without legal counsel here, Jed or someone to explain their side of it. And I know in the County Attorneys Association, the county attorneys are going back and forth on their interpretation of the law. One county attorney agrees it's this way, and the other one agrees it's this way. So you're doing a good job as far as what you're set up your own protocols. And from my knowledge, I think, I won't say they're foolproof, but at least there's communication, which is 2/3 or 75, 80, 90% of a good process, really, I believe. So that's my own opinion. And so potential new laws to align with, or new bylaws to align with the new laws. At this time, I would speak for when I can, for the County Attorneys Association. They are questioning each other on these new laws, which I question about applying them to our new bylaws if they're in question in among each other. That's what that's where I, go ahead, Sue, did you get that out of?
Well, yeah, I mean, they've been saying that all since
Since they were
came in
passed.
effect. But what, so I'm agreement with Mike is we've got to get back to the basics and develop, that's why I just got this interlocal agreement draft. I think that's where we have to go and before we can even do anything else. But we can't keep putting it off because
Yeah.
we're not following.
I agree, and that's why I wrote what I did. And I'm still offering, I think the mayor of Lima, mayor of city of Dillon, and one county commissioner should all get together, we'll discuss what it is, and then we'll present it to all the boards. Well, the one commissioner will present it to the other two.
Yeah.
They agree with it, I'll present it to the city council, or the city of Dillon, and I think
Dave.
Mr. Olson, or Mayor Olson will present it to his, and then we'll have it set up to go.
Yeah, I agree.
Okay.
So just get all of us whenever you can. I can make time for whatever, or have the three of you guys decide who's the one that's gonna represent the county for the discussion on making, writing and filling blanks in here
Yeah.
and what to give.
On this draft. Okay.
We can take the draft, or we can take what we had before and adapt, or, that's discussion. Anyway, that's open.
Okay. Sue?
So, in talking with Dr. Evans and myself, we feel that it's not fair because of this new law that it's going to be, the two mayors and a county commissioner, if that's the way it goes, that there shouldn't be the mayors or a county commissioner on the Board of Health because that gives them 2 votes, basically, to determine that. So just keep that in mind.
That's not the governing body.
This is just the interrupted agreement.
This is just creating the governing body.
Yeah,
This is just.
I'm not saying that we will be on the governing
right,
body.
I think that's just something we have to keep in mind that.
And I would agree with that statement, but
Okay. So, then we can address this, and I'll get a hold of Dave. So, all right, now, 1, 2, 3, the 3 main discussion points at the lead here. We've massaged those quite a bit. On this AAR results, I guess.
I would like to table that to the
You want to
next
table that?
Board of Health meeting, yes, because I don't think all the Board of Health members got it. I think I just sent it to everybody that attended the AAR.
Okay.
What was that?
Yeah. The after action report, or that training.
Okay, with that said, Sue, would like to table that AAR because all of the people haven't got the results of that class or every discussion.
Right, I
we
don't
went
think
through.
all you guys got it, did you? Yeah, I think I just sent to the West.
Okay. So with that said, is there overall, from top to bottom, do we have any other comments or anything regarding the agenda, topics on the agenda?
I'm not on the agenda, no, sorry.
I have a question. Sue, what were you saying about the mayor and the commissioner shouldn't be on?
They should be on the Board of Health
And the governing
and the
body of
governing
the
body.
Board of Health.
Because they would get to
It's like holding 2
basically
elected
2
positions.
votes.
Okay. Then down, okay, public discussion. Okay, I guess I'll move to public discussion comments, jurisdiction not on the agenda. Mike?
This last question, I've been told, is the hospital, and I know you don't represent the hospital, but have they came out with a position that if you don't get vaccinated, you're fired?
They are not allowed to under Hospital 702.
Right. I was just checking to make sure that nobody's fired from this hospital.
No.
And we don't know of anybody in Dillon that's with that. Because I've known some, I know for a fact that they're not based out of Dillon, but they forced, there's a company out there that's forced people to be vaccinated, which I believe is discriminatory. So
I believe that there was one person fired from Patagonia because they were vaccinated.
Okay. So that, I don't know how to do it. That should be just told to everybody in Dillon. If you're an employer, you're not allowed to ask for a vaccination status, nor can you base your employment on a vaccination or not having one.
Okay, so,
Can you summarize what the action items are for our next meeting? Because I think we kind of
we,
talked, but I just want it clarified on what's going to happen.
that's a
before the
good
next
point
meeting.
on that. For the next, we'll just start on next meeting's agenda here. And after the usual lead-offs, you know, public health update, COVID, that type of thing, we'll get in top of the order of report on this interlocal agreement. We'll just put that on the agenda.
So you guys will meet before the next meeting or?
Oh, I'm sure.
Figure it out.
Report interlocal. Okay, then, suggestions is, I'm open for suggestions on what the bylaws. Now, first, legal counsel.
Yes.
Legal counsel, I'll approach that even if possibly I had to get Thorne on the Zoom at Missoula rather than in person. He does that a lot, you know, so I could check on legal. That'd be county counsel. Now, with that said, too, our Board of Health reads County City Board of Health. So I'm asking Jed's opinion. Do I need, which isn't a bad idea, but do I need the legal counsel from the city of Dillon after they, I mean, Jed will
I'll have him look this
go
over.
this over and then Dave can look it over, so.
Yeah.
So I'll
And then I'll
just,
get back to you afterwards.
Yeah,
to
well.
have that.
Does Lyman have
yeah.
an attorney?
Yes.
Yeah, they
I don't know who it is, but everyone's supposed to.
I wouldn't think so, but I've never heard of.
Spontaneous.
Just don't have it on,
On a matter, it is,
it's more on. as
it's a
called.
retainer.
Yeah, retainer's the word.
Okay. With that said, that would cover the new laws, like the House Bill 501 and the House Bill 702 discussion on that. That would be with the legal counsel too. That would kind of commingle with the new legislation.
In fact, how I envision it is, if they're needed, we can have them there during the discussion with the two mayors and one county commissioner. And they can have that all covered at that same time.
We'll see if we can make that happen.
Okay.
Okay, and then we could impose too, well, more than welcome. I appreciate Randy and Greg showing up, for sure. It's a big help when you do come, great. I firmly believe, I said it early on, that I have very little worries about your group doing a good job.
Well, thank you. You guys said some nice things about us. We're not sure they're all true, but we do appreciate it. But mostly we appreciate you guys and you know what you're trying to do, as well as our parents. I mean, we have to try to answer to everybody, and we're trying to do the best we can. And if you have another job opening, let me know, because I'll be interested. Not in the health field. Just something else.
There you go. But now, communication's huge, you know, so that's a good thing. You know, everybody, you just got to be willing to listen back and forth to each other, basically.
Totally agreed. It shouldn't be adversarial. It should be, you know, and that's why I appreciate working with Sue and Megan.
Okay. With that said, if there's, on next meeting's agenda, if anybody or on this sits on the board or anything has something they want to add as an agenda item that just doesn't blend in, but I just wrote these 3 or 4 rough topics down. We'll go with that. And we got on here next tentative meetings clear in January. It says here, meeting scheduled next meeting, January 19th. We'll have these That's the board meeting, but this meeting for this interlocal agreement, we'll have to get with each other and get that scheduled prior, long ways prior to it. There might be a couple meetings involved with that, I would guess, discussions.
Well, then you gotta go to the
Yeah,
to the bodies. to
you gotta go
vote
back
on
and
them,
forth.
too.
And
Yeah.
to get that done by January 19th, that'll be an accomplishment with everybody's schedule.
I
Anything
think
else?
it's got to be a priority though, because that will be 6 months into the
Yeah.
new law. Yeah, so.
So, George,
We're in public discussion right now.
you bet.
Okay. I would like to see the appeal go forward before the end of the year. I would like to go before this health board and not have to educate new members. Therefore, I think you and I need to be in contact.
We'll try to get, yeah, we'll try to get, it'll all depend on how, if we can get this interlocal taken care of by then.
Well, and we can still do the appeal because it's in the contractual basis and the original bylaws. And I think it'll go rather quick, but the issue that I've got is I'm going to need some of the documents that are requested. And I don't need a whole bunch of time to study it, so if we can get together and go over that, then we can get that part finished. I'd like it to be behind us, because the intent was to help anyway, it wasn't to hurt.
Okay.
And yet, I need to finalize that process. We can't just leave it up in the air like it never even happened. We've got a lot of minutes that disclose it, and we should close it out. The other thing that I had was a piece of information that not too many people will probably appreciate. But on Sunday, Maria Bartiromo had Senator Ron Johnson on her program. And his discussion was that vaccination deaths across the country were at 16,766 as of that time. He also stated that incidents requiring hospitalizations were at 798,000 at that time. In contrast, he brought up ivermectin at 379 over a 25-year period, and the flu vaccine less than 1,700 over a 25-year period. Those are pretty dramatic numbers, and yet they're not being talked about. And I believe Senator Johnson is a respected source. He wouldn't say something that he didn't have documentation on. So I thought that should be on the public record here.
I think on public record, then we have to say that's a statement from a politician. It's not a statement from CDC or from
That's
public
right.
health at all.
That'd be fine.
If it's a report from VAERS, that data is not filtered in any way. Anybody can make a VAERS report. Does not necessarily correlate with the vaccine. We are not seeing huge safety spikes from the vaccines nor deaths. What we're seeing is unvaccinated people in the hospital. Over 80% of hospitalizations are unvaccinated, and 80% of deaths are unvaccinated as well. So that's the real risk, is COVID, not the vaccine.
Well, one thing that I'd like to state though, is we know that we've had those in Beaverhead County, a death, and we've had hospitalization. So it's not like the public doesn't know some of this exists.
I don't know what you're referencing even.
Well, that's where the credibility is concerning, because we know and we verify.
Okay.
I think just you have to reference what you're coming from. You can't just say things like that and not reference something.
Sure I can.
Okay.
If you want to get
Is there
specific,
anything-
we
anything
could,
else?
but we shouldn't.
Anything else we got? Okay, motion to adjourn, I suppose.
Yep.
Did I hear a motion?
Yes.
Okay. Second.
Yes.
There's a second.
Aye.
I've never had anybody, I've never been outvoted on that.